Hi, everyone. Thank you so much for joining us today. We're really excited to have Grace Townley-Lott here. She's from True Care. We're excited to learn about home care, how to introduce it into, our world of our caregivers, our loved ones, when it comes up, especially with Alzheimer's and disease and needing extra care and adding people to our team. So thank you again for joining us today. I'm going to let Grace take it away and just let everyone know everyone is currently muted, and at the end we'll have a Q&A. So if you have questions that come up throughout the presentation, definitely submit them and write them in, and we can go over them at the end of the presentation. All right, Grace, thanks for joining us today.
Thanks so much, Kara. It's a pleasure to talk to all of you virtually today. So let's see here. I'm just going to get started. So we're going to be talking about an introduction to home care. So basically, I wanted to upfront provide my contact information in case you have to leave before it's over, or if you have any unanswered questions, or if in the future you're running into home care questions. I'm always happy to brainstorm with you, chat with you. I'm a social worker, so I'm always happy to give you any resources I have. So that's my contact information there. And I'll also provide it again at the end. Just give you a second. All right, so just a little bit about me. I am a social worker. I got my master's degree from the University of Kansas. I've been working with older adults for a long time now, and I've had a special focus on working with people who have memory loss specifically. In my career, I've been working in long-term care facilities, nonprofit Alzheimer's agencies, including actually AFA's helpline, and in home health care. I've been at True Care Home Care for over 4 years now, and my role at True Care is to help clients sign on to our services, as well as directing our True Bridge Memory program. And then just besides my social work, I'm also an artist, and I love collaborating with my husband. He's actually a professional puppeteer, and I enjoy painting, writing picture books with him, and kind of taking a new artistic approach to cake decorating. So that's been fun to do on the side. Yeah. Okay, so today we're going to be talking about home care, just the basics. I know sometimes it's hard to know where to start when you're starting to find that you need a little extra help in the home. So we're going to be talking over the different types of home care, and that's going to be based on the payer source, whether you're paying privately or through Medicare or Medicaid. We're also going to be talking about how do you choose your home care agency, the types of services that agencies can provide, what to expect when you're signing on to home care, and then, of course, how to encourage your family member to accept help. I know that can be a major one, and it's definitely important to talk about and brainstorm around. Okay. So there's several different types of home care services out there determined by your payer source. So just a heads up before we begin, I do work for True Care Home Care. True Care Home Care is what we call a LICSA, which is a licensed home care service agency. And we'll go into what that means in the next slide. But basically, we provide privately paid care as well as services covered by Medicare and Medicaid. We're a New York-based company, so we serve the 5 boroughs and Westchester. So I do want to let you know that while a lot of home care information is universal, my personal information is going to be based on New York regulations, and specifically on my experience with True Care. So just double check to make sure your state's regulations, if you're not in New York. Okay, so let's go into the various types of home care you can encounter. All right, so starting at the top, there are lots of options if you're paying privately out of pocket for services, or if you're using a long-term care insurance policy. You have a lot of choices when it comes to your home care if that's the case. You would be working directly with, there's that word, the LHCSA, Licensed Home Care Service Agency, and that's a New York specific name, just a heads up. Other states might call it non-medical care, but basically it's just a type of agency, type of home care agency. So yeah, you can choose if you're paying privately or using your long-term care insurance policy, you can choose any LHCSA you would like, as long as your long-term care policy approves it. You can leave that LHCSA if you're not happy, and you can move to a different LHCSA. You can determine whatever hours or days that you would like your visits, and you can continue to have care for as long as you're willing to pay for it. So you have a lot of options with that top segment there. When your payer source is Medicare or Medicaid, you are a little bit more limited in your choices. So there are CHAs, here, that second word there, CHA, Certified Home Health Agency, and MLTCs, Managed Long-Term Care. And those are the words you're going to come across when you're getting home care through Medicare and Medicaid in New York. So both of these agencies, you can think of them as overarching agencies that determine your eligibility for Medicare and Medicaid home care services. And these companies contract with a number of LHCSAs to provide that home health aid. So basically Medicare, under Medicare, you can qualify for some home health care services, but this is a very short-term, very limited amount of care, maybe a few weeks. You can be eligible if you're homebound and you have a skilled need like nursing visits, physical therapy, occupational therapy, speech therapy. Medicare may also determine that you might qualify for a few hours of home health aid care, which you may receive for a few weeks, which is going to be maybe likely on the lower end of maybe 12 to 20 hours a week, but this is very short term. It's just a few weeks, and it's only in specific circumstances that Medicare will cover. Medicaid, in contrast, is actually a long-term care solution if you're unable to pay out of pocket. So Medicaid can cover up to 24 hours of continuous care if they find that you're eligible for that, and it will continue long-term. They'll reassess every so often just to make sure that's still the case. So those are kind of the three different payer sources and the types of home care you'll run into there with those. I work for the privately paid side of TrueCare. So if you do have any questions about Medicare or Medicaid that I cannot answer, I can definitely be sure to get those answers and follow back up with you. All right. So how do you choose a home care agency? This portion, we're going to be mainly speaking to those who are able to pay out of pocket because you do have more choices in that arrangement. You still do have choices with your CHAs and MLTCs for Medicare and Medicaid, but it does depend on what agency your CHA or MLTC contracts with. So this is for if you just have anyone to choose from, any privately paid home care agency. Here are some suggestions on how to choose one. So first off, ask for recommendations. Do you know somebody who's used a service that they like? Do you work with social workers at your doctor's office or maybe another agency throughout that care process that you might have had, who might have had good experiences with home care? Social workers are a great resource for this. There's the AARP Community Resource Finder. So you can search for home care companies near you. I believe it's nationwide, and you can select to see ones that only specialize in memory care as well. So there's a bunch of different check boxes you can select if you have specific needs. And so that's the communityresourcefinder.org. And then also, once you make contact with that agency, just how do you feel about your interactions with them? Are you able to feel that they care? Do they ask you about your loved one? Are they taking the time to talk with you about your needs and what you're going through? Do you have a point of contact who you can trust and who you can call directly to ask questions as they come up? Ask the agency, you know, can you transition to Medicaid covered care if your money runs low? Do they assist with this or provide guidance? Some companies only provide privately paid care, and then you would have to change agencies once you go on Medicaid. Others, like TrueCare, you can transition seamlessly. So that's just, if that is an issue, just ask ahead of time. And just remember, you have the power. Ask for what you want. There's a lot of privately paid agencies out there, and they want your business. So make sure that you are advocating for yourself. All right. So we're going to talk about the types of services that home care can provide in your home. In general, home care agencies do offer some universal types of care like home health aides. And then depending on the agency, they may provide more types of care. So I'm going to be using TrueCare as an example, since we've developed our own service packages as well. But each agency is going to be a little bit different. So, all right, so services and programs do vary depending on the agency. With TrueCare, we do provide both privately paid and Medicare/Medicaid covered services. So we do work with a number of CHAs and MLTCs to provide those home health aides. For those who are privately paying for care, here are a number of resources that we do offer: home health aides, RNs, LPNs, our TrueBridge memory care program, infusion care, escorts to appointments. Just always ask ahead of time, though. These are our specific programs, but ask your agency if you're looking for something specific like the infusion care, like hourly LPNs, whatever you're looking for, just make sure that that agency also offers that. For Medicare or Medicaid covered services, we provide whatever their assessment determines that you need. So that would include home health aides, that would include private duty nursing for people who have higher needs like trachs, ventilators, feeding tubes. Under Medicaid, we also provide consumer directed care, which is called CDPAP. You'll see that word down there. And basically what that is, it's where a client can hire their own family member or friend as their caregiver, and it would be paid for under Medicaid. And then also, if you are on Medicare or Medicaid and you find that you might need more hours than what are covered, you can choose to pay out of pocket to supplement a couple of extra privately paid hours on top of whatever chunk of time Medicare or Medicaid's covering, if you're financially able to do so. So this just talks a bit about what kind of care home health aides can provide. It's generally the most common type of home care that people are looking for when they call me. And they can provide a variety of services here. I'm gonna go to our TrueBridge memory care program. We also have this type of a program, and various agencies will have various types of programs that they have developed. So basically, our TrueBridge memory program, it supplements our home health aid services. It provides an extra layer of care for people who are having some changes in cognition, and it offers support, a little bit more support to the individual and their families and their caregivers. Our goal with TrueBridge is we're looking to bridge that gap. We're hoping to explore how the whole team, including the family, can better connect with the individual who has some memory loss. And so in order to do that, we have a certified recreation therapist. She's a wonderful woman named Jody Berman. I've worked with her for many years. She completes an engagement assessment. She learns about what the individual enjoys doing, how we can encourage them to continue doing meaningful activities using their strengths and their abilities. We also provide quarterly visits with our social worker or recreation therapist, resources and service recommendations specific to that person's memory care needs, invitations to social and cultural events just for our TrueBridge clients. And really the idea is that it's care that empowers, encourages, and engages. So that's a bit about our TrueBridge program. Always happy to chat more about that. We also provide infusion care. So this actually came up a lot during March and April, during the peak of COVID in New York City. A lot of clients needed hydration in their homes, which we can provide with our skilled infusion nursing care. And just, again, if this is a need of yours, just if you're speaking with a home care agency, see if they provide infusion care. And if they don't, I'm sure that they have a resource to direct you to. And so as a part of this infusion care, our nurses can also provide training if it's an ongoing thing, and they can train the family members in performing that task. Another service that can be provided is what is called private duty nursing care. So we have LPNs who are trained specifically on tracheostomy tubes, ventilators, and gastrostomy tubes, which are also known as G tubes or feeding tubes. And basically our private duty nursing care is for hourly LPNs that can be provided through Medicaid if you have one of these needs and you also qualify for Medicaid. And it's helped a number of people who thought they were stuck in a nursing home because they had complex needs and they couldn't afford to pay privately for care. And we also can provide, basically we can provide these hospital level services at home through Medicaid. And again, if you have these needs, just ask your home care agency, do you provide this type of care? Okay, great. So next we're going to be talking step by step about how to sign on to care and what happens next. So this is specific to TrueCare, but I imagine the sign-on process is similar with many types of privately paid home care agencies. It's pretty simple. The Medicaid covered care starts a little bit differently as you'd be signing on through your managed long-term care company, but that is also a simple process as well. But okay, so if you are looking to start privately paid services, you would first have a call with me. I'd be chatting with you about what you're looking for, what type of care you need, the days and times that you're looking for the care. I'd be asking questions about what your current situation looks like and your preferences, your needs. And then I'd be sure to be writing all of this down and passing your feedback on to our team so everybody's on the same page. If you want to move forward, we would just need a contract signed either by the client or the client's legal representative. We can easily send it to you for electronic signature so you don't have to worry about printing it out, scanning it back, anything like that. And then we start care. So we have the nursing assessment. This happens at the beginning of care. The nurse will be contacting you to schedule the visit. And the nurse would also be reaching out to your doctor, your primary care physician, to be getting orders for home care. The nursing visit and the home health aide's first day is generally going to be that same day. And then we'll want to stay in touch. How is it going? We want to hear about your feedback, what's working, what isn't. If the aide isn't the right match, we understand sometimes personalities just don't align. But luckily, we do have a large number of aides to choose from, and we're happy to send you a new aide if you'd like. And if the aide's great, we want to hear that too. Okay. So all of this is well and good, but unfortunately, we cannot provide care to somebody who just refuses to open the door to our caregivers. I've worked with many families over the years, and this is often people's number one concern. How do I get this person to accept help? So here are a couple of ideas about when you have a reluctant family member who doesn't necessarily want to get on board with accepting home care. So I think the first thing to do is to just put yourself in their shoes. They're not trying to resist because they're being difficult or trying to make life hard for you. Truly, I think we've all felt accepting help is difficult for many people, no matter where you are in your life process. But I can only imagine that as an older adult, you might see it as the beginning of a loss of independence, that would feel pretty scary. And so, your loved one best, what they're most likely to respond to, but here are a couple of suggestions. easing into it, introducing these types of services as temporary. There's nothing more intimidating than thinking that things have changed forever. You could phrase it maybe like the caregiver is there to help out over the holidays, or while I'm gone on vacation, or while I'm busy with my big project. Just somebody to help out while I can't be there for you. You could start with some shorter hours and ease into longer ones. It might feel a little less intimidating if the caregiver is not introduced as a home health aide. Again, it depends on the person. Sometimes people do respond well to a more medical introduction, and sometimes people respond better to a more like a friend introduction. And if you're going the friend route, maybe you meet that aide first, learn a little bit about them. Maybe you show up at the same time at your family member's house and introduce the aide with a common interest that they might share with the person. Like, you both like singing. I was hoping that it would be fun to take a trip down memory lane and sing some of your favorite songs this afternoon. Or start with some sort of engagement activities or housekeeping instead of with personal care. Just kind of keeping in mind that it might be a little less intimidating having someone in there doing your laundry or helping prep your food or walk you to the park, rather than somebody who comes in right away and starts helping you go to the bathroom. That's much more personal and obviously can be a challenging thing. Okay, another way to do it is, take the blame. See if your family member maybe responds to the idea that their accepting home care will be a favor to you. It makes them feel like they're helping you when they're accepting the care. And tell them how much you worry. Tell them how it would put your mind at ease knowing that somebody's there for them. It puts them in a more powerful position of doing you a favor rather than a weaker feeling position of having care imposed upon them. So it's like it's their choice and they are helping you out with this. Or, of course, the other option is give the blame to a professional. So this has worked a lot as well. If they have a close relationship with their doctor, you can ask their doctor, a trusted doctor, to write a note that says home care is needed. And if they really respect that person, if they often do what that doctor says, that can be a good route to go. Make a few copies of that note because it can get misplaced, it can get forgotten about, and it's good to have a fresh one to hand over. Maybe, several times, depending on the day. So make a number of copies when you get that note, but it can be helpful. Basically, right now with COVID, home care is also an excellent alternative to facility care. So I know a lot of people are trying to avoid that. So that can be also a route to go. And I'm always happy to chat and brainstorm about this. And you can also call the AFA helpline and talk to one of their licensed social workers. I know that topic comes up a lot as I used to work there. So you are definitely not alone if you are facing this issue. And that is it. So there is my email address, gtownley@truecareny.com. And my phone number, 917-620-9102. And here's some AFA supportive resources here.
Great, yeah. And so ultimately, some of the resources that, we offer at AFA is we do, as Grace mentioned, have our national toll-free helpline that's open 7 days a week. So if you have questions about things that, Grace, has talked about today, definitely, type in your question now for us if you'd like us to answer it. And we can go over it because we know home care can be a challenge, especially during COVID times as well. And if it's something where you might not be able to process it now, you can definitely get in touch with, our helpline or contact Grace. And if you need to get her information, you can definitely contact us and we can provide that for you. We do have one person, they have questions. Will home care, your agencies or other home care agencies, do they offer hospice?
Yes.
Okay.
Absolutely. Hospice does provide some home care services, and it does depend on the assessment. There's an assessment that determines how many hours are covered, but yes.
Okay. So that would have to be covered. They'd have to evaluate. Can you actually, Grace, can we have you go back to your slide real quick? We have a lot of questions people asking to get your contact information.
Oh, yeah, absolutely.
Perfect. We do have a question about, is it covered by Medicaid for hospice care as a follow-up, or Medicare? Again, for that, you need to speak with a benefits counselor. That can vary. And I'm not sure how much, Grace, you can touch on that for your company specifically.
Yeah, I would definitely talk to a benefits counselor.
Yeah.
Yeah.
At that point, yes. I have someone else who says, can you ask a home care agency to give preference to a male or female, as my dad is comfortable being with males?
Yes. Basically, we want to hear all about that person that we're going to be providing some care for, because we want to know how they're going to be the most comfortable. So yeah, absolutely share that information.
Definitely. We want to make sure, I think, as Grace pointed out, that they're responding best to a person. So whether, let's say this person, would respond better to someone within the Puerto Rican culture because they are Puerto Rican, and that's something that they can connect with their person on in memories. We want to make sure that they're able to feel comfortable and be as content as possible as they're going through this. We do have someone else. They said, can the CHA service be 7 days a week? And also, can the service last years if approved?
So the CHA, the Certified Home Health Agency, is what they're talking about there. That is through Medicare. So Medicare does not provide as much. They don't provide, it's not a long-term situation. It is a shorter-term situation. So that's often for people who are coming out of the hospitals, out of rehabilitations centers. And it's a few times a week, and it may be a few weeks long. So if you're looking for a long-term situation, that's where Medicaid would come in, if you're unable to pay privately.
Great. We have someone else. They've just asked, what if the healthcare agency refuses to wear a mask all day, but the person, the client essentially, they have allergies, or sorry, I read this wrong. The home health care aide says she has allergies, so she can't wear a mask, but it's concerning to the family and the client.
If you're running across that, I think I would recommend definitely reaching out to the agency. Proper PPE is especially important right now. And, I know that different states have different things going on right now, but it's important that home health agency is keeping up to date with the CDC guidelines and the Department of Health. So if there is something coming up that is concerning to you, if the home health aide is not wearing a mask or gloves, reach out to the agency and tell them and ask them, what their specifics are.
Definitely. And I think this goes across many lines. You want to have that open communication with the agency, what their policies are, especially in guidelines for, basically everything, because at this point they're providing care. So if something seems a little, fishy, right? Like if I was someone who was, a caregiver taking care of someone, and I was like, something seems a little off right now. I don't know why this is happening. Then I myself would call Grace and say, hey, Grace, like I have this aide who was sent, maybe by your agency. I have questions about it. And then she'd be like, oh, great, thank you. We can work together as a team, because the other part of this is remembering that who you're allowing to kind of come in the life of your person, being a home care agency, you're on a team together. And so the goal would be to help the individual, live as long as possible as with whatever care you can kind of get at that point that's comfortable for them. I do have another person who asked, so how are home visits currently being handled during COVID? Are agencies being limited on the amount of clients that they can see? And our aides are or are they working with other aides or contractors during this time?
I mean, so
Yeah.
yeah, so for COVID, basically we are going by the CDC and the Department of Health guidelines. So we are, I mean, I don't know about other agencies in terms of who
Yeah.
they're contracting with or anything. We have only our employees. They're all our
Yeah.
employees, our home health aides. And so, you know, we haven't had any issue regarding that. It's just ensuring, of course, safety. Everyone's wearing the PPE and acting in a safe manner. Yeah.
Yeah. And the other part of this, if you have questions about, you know, what agencies are allowing, you know, give them a call. You know, states are doing things differently, as well as different agencies have different models. So it's important to know that if you have questions about, you know, how they're going to handle their approach, like Grace said, you're in control, and it's almost like you're kind of interviewing this company, like, to come and work for them. So this is the point when you're hiring, you know, a private agency specifically in that regard, you know, to ask them questions about how they're handling this, as well as, you know, ask them like, hey, Grace, what happens if my person does this? How does the aide respond to it? And that's helpful to get insight because, you know, for Grace specifically in her position, she's had this come up before. So we can most likely assume, you know, with her agency as well as other agencies, they've come across certain problems and concerns before, that they are there to reassure you and work with you, if that makes sense. Yeah. Okay. So we do have someone else, and Grace, if there's anything else you wanted to add to that, let me know. We do have someone else who asked if we want to hire a private individual. I'm not sure if we can answer this one. If they want to hire a private individual that's not part of an agency, what should we do to make sure they're qualified? You know, for this, typically, if this comes up, I would say you could do a background check of them. It's what you're comfortable with, but at the same time, I think the thing to think about, and Grace, you can add on to this, is if you work with an agency and let's say the person gets sick and they can't come in, you're most likely going to have a backup person, you know, potentially come in to replace the aide, and let's say the aide leaves the agency or something. You want to touch base on that and how that would work?
Sure, yeah. So basically, yeah, an agency allows you to not have to worry about the scheduling part of things, or any sort of tax issues or, you know, anything like that, especially an agency like this where, you know, you pay the agency directly, and then the agency pays that aide and works out all of their healthcare and all of that on our end. So yeah, you don't have the headache of trying to figure out, oh, so-and-so is unable to come in tomorrow because she has another obligation. Who's going to fill in for my mom? That's then our situation, and we have so many aides, we're able to fill in somebody else for that, you know, for that role. And so yeah, and I can't speak to regarding hiring a private aide. You know, it depends on the person. You know, do they have any sort of training? What is their background? Can you talk to their references? But, you know, they don't have to go through any sort of a certification to be a private aide, so it's a little trickier.
Yeah. And kind of like what Grace is saying, you know, for an example, one of the helpline calls I've had was, you know, a mother who was actually taking care of her sister, and the aide just decided not to show up, but she still had to go to work. And so working with an agency, you know, allows, if things come up, you can connect with them, especially when, you know, many people are working and caregiving at the same time. And so the question I would think about, if you're in between, you know, privately hiring someone else, you know, not through an agency versus an agency, is what would happen if something were to come up, you know, for that person that you hired privately, and think about what's feasible or not, and see how that fits with, you know, your schedule and what's going on. Because in case there is an emergency, you just want to be prepared. And so those are things to think about. I do have someone else who asked, How does cost work for agencies? Do they do it hourly, or can they do it in a package deal?
It depends on what type of services you're looking for. And it also depends on the agency, because, agencies provide different types of services. We provide hourly care as well as live-in care, and that's a little bit different because hourly you're paying for, say, 6 hours in a visit, whereas live-in, that person is staying there 24 hours and also sleeping for part of the time. So for that, we have a flat rate versus if it's an hourly shift. And the hourly shifts can also cover 24 hours, but then that's generally looks like a 12-hour shift plus another 12-hour shift.
All right. Okay, so it looks like that's what we have for today. I just want to say thank you, Grace, for joining us today, and having this chance to have people ask questions, about what it's like to, work with home care agencies when it comes up. And so what I'll be doing is, if you guys need her contact info, it's on the screen right now. If something were to come up, you can email myself, and that would be actually attached to your registration. So you can contact AFA and we can get in touch with you that way. And then we'll be able to put you in touch with Grace as well about this. So we're just getting a lot of thank yous, and thank you for taking the time to go over this. So Grace, I appreciate you being here with us today. This is being recorded, so that just so you guys know, for light housekeeping, this will be on our website, should be up within a week, so you'll be able to see it then as well. Okay.
Thank you so much. I really appreciate you asking me to do this, and to the Alzheimer's Foundation. Thank you for being such a great resource.
Yes. Look forward to more webinars coming up. And again, if anybody has questions, feel free to reach out to Grace and myself. We'll be able to connect with you and, address any other questions that you may have. So take care, everyone.
Bye.